AI to speak about what it is all about. Thank you. Over to you, Mr. Naman.
Thank you, Jyoti. First of all, thank you all of you guys for coming here and covering the one of the biggest news of Maharashtra, especially in healthcare. I would like to first mention about our leaders, clinical leaders here who are sitting here, and because of them, I think we are starting this AI prevention model in Jaslok. But before talking about what is the product, how it is going to happen, it's important to talk about what are the challenges we have right now. So if you see currently, one of the core challenges that we have in Indian medicine, medical system is it's symptom-driven approach. Patients do not go to doctor unless they have symptoms. So doctors are trained and expected to treat those symptoms instead of, they have to relieve those symptoms quickly. But overall, we're missing out the underlying conditions. So prevention is extremely important for everybody, and AnginaX is leading that, working with Jaslok partnering with AnginaX on specifically AI-driven cardiology prevention model, Maharashtra's first model, and I would like to talk about that later on, but I would like Dr. Mehta sir, who is leading this effort, and he should be able to talk about that program as well. Thank you.
Thanks, Naman. So let me invite the legend in the field of cardiology, who has been in the field for over 53 years now, who needs no introduction, Padma Bhushan Dr. A.B. Mehta, the Director of Cardiology at Jaslok Hospital. Sir, can we have few words from you?
Thank you. Naman gave you some background. I would say the absence of symptoms is not the same as absence of disease. Number of times I've seen that the people get the startling news that they have hypertension or diabetes when they get their insurance checkup done. So therefore, we realize that both hypertension and diabetes can continue to damage your health without your knowledge, uninterrupted. Can we prevent? Certainly not prevent, at least postpone by controlling diabetes and hypertension, provided you know it. When we talked about sudden cardiac death, and when we came to know that a lot of people, especially startlingly more in the recent past, that one Dr. Prasanna Naidis, the Director of Cardiology at KEM Hospital, dropped dead soon after the coming back from gym. I don't remember the name, but 23-year-old girl, while she was performing dance on the stage, collapsed, and she was no more. This unfortunately happens while the people are at zenith of their career. They have young children, they are about anything between 30 and 45. So this is disaster, a big calamity to the family. This problem is very enigmatic. The problem is that the patients do not come to a doctor until they have symptoms. Even doctor may fail to detect any abnormality because most of the tests are coming normal in them, including even a stress test. The reason is simple. The blocks in the coronary artery, which is made up of fatty acids and cholesterol, exist into the coronary arteries, and then there are about 30-40%. They are not detectable, neither by any ancillary medical investigation nor patient notices any symptom. What happens is due to sudden stress, like external stress or internal stress. External stress, I would say, rigorous exercise, which raises the blood pressure and which raises the pulse rate to a very high level. And that plaque, which is only 30-40%, and if it is covered by a thin membrane or a thin cap, it ruptures. When it ruptures, this plaque, which is only 30-40%, over a period of minutes or hours, becomes 100%. When it becomes 100%, it precipitates heart attack. No tissue in the body can remain alive without blood. So that part of the heart where this artery is supposed to carry blood gets no blood, and heart attack is supposed to have ensued. 50% of people who sustain heart attack are unable to reach to the hospital because of sudden death. Now, 65% of the patients who get admitted in our hospital with heart attack did not have any symptoms whatsoever prior to their admission to the hospital. So then I think it becomes very, very important that we find out and weed out from the society who are those individuals who are at a higher risk of developing sudden catastrophe. If we come to know that these are the people who are at a high risk of developing sudden heart attack and sudden cardiac death, then I think we can intensively treat them, and in vast majority, if not all, we may be able to successfully avoid precipitation of heart attack in them. We are not finding a single effective program in Maharashtra state, and it's a shame that the medical profession has not paid as much attention as it ought to have given to this aspect of health. Prevention is a very important aspect of healthcare, and prevention is a very important aspect of medicine. We don't have to necessarily treat diseases, we have to prevent diseases. And we want to popularize this concept. We want to encourage people to come to us, irrespective whether they have symptoms or no symptoms, and give us an opportunity to find out, evaluate them, so that we can be helpful in preventing such catastrophe. And this is entirely the aim and objective of this program which we are going to launch. This is what I would say. Right, sir?
Ajit Desai to speak few words. Very senior cardiologist, additional director for Jaslok Hospital with over 35 years of experience.
Well, good afternoon everyone, and we are extremely grateful that you have made it here, because the program which Jaslok Hospital is going to launch is something very, very important. In the sense, just to give you an idea, almost about 250 people die of a heart disease every hour in India. And almost unfortunately, 50% of the heart attacks since 2020 are occurring below the age of 40 years. This is the statistical data which is being presented as far as India is concerned. And of all non-infective deaths in the country, almost about 70% are because of heart disease. So you can understand that the problem is humongous. And we know that prevention is the best way of taking care of any disease problem. And what we are trying to do with the Jaslok Hospital along with AnginaX is to screen the patients who are at a higher risk or moderate risk or lower risk as far as their cardiac profile is concerned, and then I advise them accordingly. The process is extremely simple, and it won't take more than about 2 minutes to assess them. Particularly if they have their previous investigations with them ready as far as certain investigation, not a whole battery of investigation. The investigations basically related to cardiac profile, as we call it, the ECG, the lipid profile, the blood sugar, and an ECG and the other things, which will make them, as well as certain examination of the patient as far as what is his history, whether he's had in the family history of any heart attacks or not, whether he's a smoker, whether he's having tobacco or not, And on these basis, basically on the basis of the cardiac profile, we will be able to identify these patients as to who are going to be at a high risk or moderate risk, and accordingly we can advise them with medications or with further investigation to take care of themselves. So this is the first program which is being implemented in the state of Maharashtra, and Jaslok has taken the initiative to implement it here, and we are extremely keen to see that it is implemented in the best possible way with the help of your assistance for promoting this particular aspect of the prevention of cardiac problems. Thank you.
Officer, Dr. Milind Kharte, to let us know about how does it work together with Jaslok.
Good afternoon. Thank you for being here. I would share a few words. Of course, Dr. Arvind has already given a lot of details about it, but I will say that Jaslok has 52 years of legacy of care, compassion and excellence in treating patients with complex diseases. But we also focus on prevention of those diseases, and our focus has been very much prominent on prevention, and collaboration with AnginaX is one such example. In fact, there was a lot of data that Dr. Mehta spoke, but cardiovascular diseases is currently the biggest killer currently in India. And if you see, most of the deaths are, most of those patients are below 50 years of age when they get those cardiovascular diseases. In fact, if we compare to the Western countries, we are a decade earlier to get all those cardiovascular diseases, and that is when the most productive period of the life is there, and hence it is important to go into the prevention mode rather than the treatment part. And this collaboration will help us understand the biological and the social determinants of early heart disease and their interaction as to enable us to prevent significant number of casualties due to heart attacks. And with this AI-powered tool, we will be able to convince the patient for early intervention to modify lifestyle or start treatment and for preventive purposes. So, in short, we prefer patients coming to our OPD rather than to the emergency medical services. Thank you.